Our next fellow is Manya Schmidt from the School of Nursing. Manya received a bachelor's degree in nursing from Washburn in 1978. She earned a master's degree in nursing from Case Western Reserve University and has certificates as a nurse-midwife and family nurse practitioner. As a student, Manya was a member of the Student Nurses Association of Washburn and played on the softball and volleyball teams. Manya said of her time here, "The School of Nursing provided me diverse educational opportunities which allowed me to choose a career path that best met my personal and professional goals. The concept of being a change agent equipped me with the determination to make midwifery care available to women desiring a hospital birth experience." Manya has worked her entire career caring for women and families during and after pregnancy and delivering midwifery care to underserved areas throughout Topeka and northeast Kansas. She works at St. Francis Health's Female Pelvic Medicine and Reconstructive Surgery Center, and she is a professor in Washburn's Doctor of Nursing Practice and Family Nurse Practitioner programs. Friends and colleagues have noted her dedication to the nurse-midwife field. Sharon Miller said, "I'm very proud of the pioneer work you have done as a nurse-midwife in Topeka and surrounding areas, serving as a mentor and role model for students and providing quality and compassionate care for the women and families." Anna Munn said, "Thank you for all you do for the women in our community and for helping our student nurses become exemplary healthcare workers." Manya was the first certified nurse midwife to attend hospital births in Topeka in 1994, paving the way for nurse midwifery care to become established in the community. She's a member of the American College of Nurse Midwives and has gone on medical mission trips throughout the world. Family members Adam, Ashley, and Beckham collectively said, "It's rare that we go somewhere and not meet someone whose lives you have touched through your work. Manya Schmidt, she's a legend," we have heard, and it's true. We are so proud of you and the path you have paved for nurses and midwives in our community. We are pleased to honor Manya Schmidt as a Washburn Alumni Fellow.
Good afternoon, and I cannot say how grateful I am to be here on the 150th anniversary of Washburn with my family, friends, faculty, and fellow fellows. I must say I am humbled to have been selected for this honor and to join the company of former School of Nursing Fellows. I could not have had the career I've had without support from many mentors, my family, colleagues, who many are here today, and I'm so thrilled about that. A little aside is, public speaking was one of the very first courses I took as a freshman at Washburn with Dr. Dorothy Dandridge. I don't know if any of you were around, but she was here. But she would not be pleased that I have not progressed much since then. Unfortunately. When I began at Washburn in 1978, there was no School of Nursing. And I was really not quite sure what I wanted to be when I grew up. I was just kind of taking gen ed requirements and waiting to see where life took me. My older sister was a nurse, and I saw her with the ability to move freely about the country and always find a job, and I think that sort of appealed to my sense of adventure, that I would be able to get a job anywhere, anytime. But I've been in Topeka my whole career, except for 18 short months when I moved to Columbia, Missouri, and then came back to Topeka. So I guess that sense of adventure really didn't have much to do with my career choice. But looking back, I was accepted into the second half of the second class in the School of Nursing. And it was really a small faculty. I feel like we got to know all of them very, very well. And Audrey is here today, which just thrills me to death. She was one of our professors, and it was small and it was intimate, and they really instilled in us confidence and the drive to succeed and to be change agents in our chosen paths, and that has served me well in my career. They had very high expectations of us. We were expected to succeed and make the program viable and visible. So we were charged with a lot, and I think because of that, I was able to accomplish the things that I had gone on to accomplish in my career. The varied clinical experiences that we had every opportunity to learn about healthcare in the Topeka community and visit. We didn't just do clinical in one spot. We visited everywhere. We did clinicals in lots of different facilities, and I think that probably gave us a rich opportunity to see and figure out what our chosen path might be. But it wasn't until the birth of my first child in 1982 that I found my passion in caring for women and children. I had a birth in a freestanding birth center in the early 80s, and I think the care that I received there from the nurse midwives made an indelible impact on me, and I knew in my heart I had to be part of that kind of caregiving and that kind of environment. It was innovative, it was controversial, and it was exciting. The women there were positive, invested, and passionate. I knew I had to figure out a way to become a part of that career. And at that point in time, there weren't many nurse-midwifery programs around the country, maybe about 13, and none of them were nearby. And I was starting my family, and it was like, I can't uproot my family and move to go to school. So one day in 1989, a small ad about this big appeared in a catalog, for childbirth educators, and it was advertising the first distance learning program for nurse midwives. And you had to have your own place to be able to do your own clinical where you lived. And I was, at that time, was working as a family nurse practitioner at the birth center where I had my baby. It's like I never left. Once I had my baby, I kind of started working there. And, it was like, I called the lady who was the program director and I said, I'm your perfect candidate. Sign me up. And that's sort of the beginning of a whole nother story, but it was the best. I was accepted into the very first class of that distance learning program. It was a class of 20. And to quote Kitty Ernst, who was the founder of the program, she said, "These were the most courageous people I have ever seen. Who would ever come to a graduate education program in a chicken coop in Perkiomenville, Pennsylvania?" Which, if you look at a Pennsylvania map, you won't find Perkiomenville. It's that small. But that was the beginning of my nurse-midwifery education, and again, I was charged with being a change agent. Her motto was, "You are to go out and make midwives." We wanted to have 10,000 by 2,000. That was her goal. And I was just back in Hyden, Kentucky. The program relocated to the Frontier Nursing Service. And I got to attend my 25th anniversary there and relive and retell stories of those early days. And now those of us who were in the first couple of classes are fondly referred to by the Frontier Nursing Service as the chicken coopers. But again, seeking this educational opportunity with innovators and visionaries gave me the ability I needed to move nurse midwifery into the mainstream in Topeka, Kansas. Nurse midwives had practiced at the freestanding birth center and done home births in the area since the early 80s when the birth center first opened. But with the support of two other risk takers, Dr. Bob Barnett, who's also a Washburn Alumni, and Dr. Tom Wiley, they sponsored me to get hospital privileges. And so in 1994, I was the first midwife to do hospital deliveries here and move delivery into the mainstream and pave the way for nurse midwives now who have thriving practices in both hospitals here in Topeka. And to make that option an option for all women and families choosing birth, no matter of the location of where they want to birth. So my career in a nutshell, I must recognize without fail where it all began at Washburn, with the faculty who pushed us to become the change that we wanted to see. I want to end with a quote from John Kennedy that sort of summarizes my feelings as I've been anticipating and preparing for today. As we express gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. And I also can't part without giving a shout out. I have 2 children that are both School of Nursing alumni as well. So it makes me very proud.